Hello and welcome to Bucks County Spotlight on Prevention. I'm Ron Rowland, the Prevention Program Coordinator for the Bucks County Intermediate Unit. With me today is my friend and colleague in prevention, Dave Fialko. Dave is an internationally certified prevention specialist and nationally certified tobacco treatment specialist with the Council of Southeast PA. Thanks for joining me, my friend. It's great to have you.
Good seeing you, Ron. Thanks for having us.
Thanks, Dave. You know, man, I run a health and phys ed conference every couple of years for health and phys ed professionals throughout the region. And when we all come together and plan our conference, they're always like, we got to bring in Fialko. He's the man. We got to bring in Fialko. And, you know, I say that because educators know that you're well-researched, you're up to date on trends, and really the area's expert on these issues. So thanks again for being here, my man. I appreciate your time.
Appreciate the kind words. Happy to be here.
Right, man. So Dave, I'd like to run our session a little differently today than I usually do. With you're okay, what I'd like to do is just shoot out a bunch of questions that we typically get from young people related to marijuana, and giving you an opportunity to respond to them based on your expertise in their area. Is that all right with you?
Sounds great.
All right, so let's do it. The first question is, how is marijuana different than what it was in the past? You know, a lot of times we hear that the marijuana from the 70s and the 80s is different than what it is today. Is that true? Is it different?
Yeah, it is. You know, when the two things that really house a change is purity and access. You know, with purity, we've seen the hybridization of the cannabis plant over the last really 20 years. We've seen the most growth in this change, to where in the 1980s, 3.5% THC by volume, 90s up around 5, early 2000s getting that 10, 12. Now we're on averaging about 15% to 20% average for just the 30.
Is that the actual active
tetrahydrocannabinol, which targets the CB1 receptor, which is responsible for the euphoric response. So now we're seeing on average anywhere from 15 to 30, depending on the strain of the cannabis. And that's just for flowering. You know, the hash oil products such as shatter, wax oils, crumble, those are going to be higher. Those anywhere from, you know, 30 to 60 to 80 to 100%. But most of those hover around 60 or 70% purity. So yeah, purity is definitely higher as access is more readily accessible due to not only the legal market, but and whether it's medicinal or recreational. There's going to be diversion there, but the black market is alive and well too.
Yeah. So the next question has to do with addictive. Is cannabis indeed addictive? We've heard that it's not addictive. It is addictive. Can you set us straight on that? Is it addictive?
Yes, well, the DSM-5 has, you know, cannabis use disorder. You know, so yeah, you know, you can diagnose it, you can identify, you know, specific behaviors associated with its use. Withdrawal symptoms are in fact a reality, and you know, it meets the qualification for a substance use disorder. The brain changes with more exposure, it builds a tolerance. And the individual becomes, as we say, habituated or dependent on that substance to meet a baseline.
Okay, so it is addictive. All right. So here's a question I get all the time, Dave. So if marijuana is so bad, then why is it recreational legal in so many states? So many states are making legal recreational marijuana. Why would they do that if it's such a bad product?
You know, well, you know, for the last couple of decades, we've seen a growing acceptance. And, you know, a lot of it has to do with the perceived health benefits associated with it, which medicinal marijuana, you know, hey, if you're having a conversation with your medical provider and there's the risk benefit and it appears that the benefit outweighs the risk of using this medication, then, you know, by all means, continue to have conversation with your medical doctor and, you know, move forward in the way that most benefits you and the illness or the symptoms that you're experiencing. But unfortunately, many of the perceived health benefits are being used and misinterpreted to promote recreational use, which I don't typically like the term recreational. It really should be referred to as adult use, because you know, the recreational kind of sends a different, it lowers the perceived level of harm about it. And then, of course, you know, the ages 18 to 34 being millennials, they are the forefront of this change, with 68% of them favoring legalization. by far the highest percentage, of any age cohort. So we're continuing to see it. It's just passed in New Jersey. It's going to more than likely pass in New York, and so I would imagine PA is close behind.
Yeah, I think you're right. So you're a prevention guy. So what is the goal of prevention when it comes to marijuana or cannabis? Could you give us some? Let me backtrack. Could you clarify? Is it marijuana? Is it cannabis? Are they one and the same? Is there?
It's really. I look at it as cannabis because that's the clinical name of it. Okay. So I like to stay clinical. I like to stay factual. I like to avoid misinformation.
Okay.
So I call it cannabis.
Cannabis it is.
Really, the driving goal of prevention, at least in the way that I look to engage the field from a public health standpoint, is raise the perceived level of harm if it's low about something that has potential harm for public health. Right.
Okay.
Encourage healthy pro-social interests and educate communities on how there's alternatives to substance use, abuse, misuse, and of course counter misinformation. So countering misinformation is a big part of prevention.
Okay, great. So Dave, as we wrap up our time together, is there anything that parents can do to decrease the likelihood that their youth will experiment with cannabis? What would you tell a parent to really help support their youth?
Yeah. Hey, if you're going to have the conversation, with your youth, make sure you have facts. Don't make sure that you are you're not promoting any misinformation, because if you give them misinformation, then it comes back and then they disregard future. That's what we follow in prevention as well. We want to make sure that we're using factual information. But really, most importantly for parents, encourage interests that require skill and effort, result in, positive pro-social recognition from not only, the parents, but their peers. Right. Give them that sense of accomplishment through healthy pro-social experimentation. And that's really the job as a parent. We role model and we provide young people with, experiential, learning and, the opportunity to identify where their skills lie so that they can put more effort into it and see reap the benefits from it. So, that and role modeling, clear boundaries, expectations, the usual stuff. But because if we don't provide them with the opportunities for the healthy pro-social experimentation, somebody else is going to come along.
Somebody else will, right? Absolutely. I'm with you, brother. Yep, I agree.
Yeah.
Well, Dave, thanks so much for sharing your expertise today. Really appreciate you being with me today.
You got it, Ron. Thank you for the invite.
All right.
Thanks for all the work that you do.
Thank you, my friend. Thanks.
Take care.
Thanks for joining us today. I'm Ron Rowland for Bucks County Spotlight on Prevention.